there seems to be this very, very common theme within managing rare disease about communication and a failure of communication within health management. And I was having various conversations with different people and talking about, you know, the different challenges we've had, different situations we've had when, you know, we haven't felt necessarily seen or heard, or mistakes have been made, or we've had to kind of run in and rescue things, and the frustration that causes, because ultimately this is, you know, our health on the line, and feeling as though no matter what we do, sometimes things just don't change because they're so ingrained on a kind of structural, systematic level, the way that things are done, and you're very much hoping for an amazing individual to come along and, you know, make sure that they've got their ears wide open and they're ready to listen to whatever it is you need. And anyway, as I was listening to these conversations, as I was speaking to different people, and since that time on Saturday, it kind of has made me think a lot about where I used to be in my health journey, where I used to be with my disease. Basically, I spent a heck of a lot more time in hospital when I was younger, more than about 5 years ago. And it wasn't an unstressful time, definitely. I also know it wasn't particularly unstressful for my parents either, particularly my mum, who used to come along to all of my appointments with me. And yes, there would be situations where you'd feel as though, or I would feel as though my healthcare wasn't being managed in the right way, or things had been overlooked, things had got forgotten, they hadn't been booked, it was difficult to get hold of the right person. And it was incredibly frustrating. It was incredibly disempowering as a patient to feel as though those small things, you know, that the trust that we put in other people to look after us, sometimes it doesn't feel like it's always met. And there was a point where I reached in my healthcare, in my health journey, about 5 years ago, where something really landed for me in terms of being able to communicate what it was that was going on with my health, and being able to manage those relationships so that things got better. And so I kind of wanted to jump on. That was a long prologue. I wanted to jump on and basically share with you the 3 steps I think that I have found to be more than successful each time now when it comes to, you know, a flare-up with my health, or needing to be at the hospital, or appointments, or, you know, emails with consultants. And basically sharing what it is I've discovered as a result of being very experimental. So the first thing I've worked out, and I would call it an absolute golden rule, is to absolutely consider yourself your own doctor. Consider yourself at the centre of your healthcare. So that means if you have a condition, a rare disease, MEN1, whatever it might be, make sure you stay right at the centre of that situation. And even though we have teams out there to look after us, we have specialists, we have experts, we have doctors, we have professionals, and they're doing their best all the time for us, ultimately we are a tiny, tiny grain of sand on a huge beach, on an absolutely huge beach. And to expect that, you know, things are always going to run smoothly is just unrealistic. But I found that the way to ensure that actually I stay on top of things, and when I'm on top of things, that then means that at least I have the knowledge and I have, you know, the wherewithal to go to people when problems happen. I really, really need to be a doctor for myself. I need to take charge. And a lot of the time it's uncomfortable because it means coming across as demanding or bossy or as if I know what I'm doing, or maybe insinuating that I know better than someone else who's in a professional capacity. And I think I've had to really let go of that narrative because it's incredibly unhelpful. It's also untrue because ultimately I am kind of an expert in my own health. In fact, I am the expert because the health is mine. And yes, obviously we've got specialists and medics and scientists looking at all the data and stuff that's been drawn from that health, from my body and what's going on. Ultimately, I'm the one experiencing it. So that makes me kind of head of the team, if that makes sense. So I would just urge anyone really, if you're there and you are finding that, you know, it's very difficult to keep on top of things, it's very difficult to, you know, there are constantly mistakes being made, you know, things are not going the way that they should do. My advice or my experience has been just to stay really on top of things, stay on top of the details. Don't be afraid to speak up in situations where you feel as though you have an opinion that needs to be heard, or you think a mistake might have been made, or some need hasn't been met. And to maintain that throughout your experience, because interestingly, those who are there to look after us respond better when we are feeling and when we show that we are involved and interested in our health. And that's actually an easier person to work with ultimately, which kind of brings me on to my second point. And my second point is to remember that in this game of health management, of healthcare, we are the patient, and then we have other people who are outside of us looking to help us and to keep things going, you know, from a management point of view. And maybe they have a, you know, certain amount of expertise or knowledge or skills or whatever that we don't have, and they're coming in to help us. So I like to think of it as a team. So I refer to my health team, my endocrine team, but actually I see myself kind of at the top of that pyramid, if that makes sense. And I've got, you know, my consultants underneath me. I've got, you know, surgeons there with them. And then, you know, I have other practitioners as well who look after me, who I go to for different stuff, my gut health. I've got, you know, people underneath that as well, levels underneath that. It's kind of like, it looks a bit like a pyramid, and I'm kind of at the top, and I'm in a way what's holding it all together. And so we create this team together. We have this sense of we are working towards the same goal, and being someone who's proactive and curious and enthusiastic about my health, that really, really helps kind of solidify that sense of teamwork, of collaboration, of joining together. What I've also learned about working in a team is that you have to respect and give space to the people who are working with you. And ultimately, as frustrating as it can be when, you know, we're not getting the results we want, or we're not delivered the news we'd like, or mistakes get made, or, you know, we have to go back in for a second lot of blood tests because the first ones didn't work. As frustrating and annoying as that can be, and kind of unacceptable on many levels, we're working together within a very, very imperfect system. If you're watching in the UK, you'll know that the NHS is under a huge amount of pressure right now. I have got to a point now where I completely trust my consultants, and I trust that they know what they're doing, and I trust that with a certain amount of interest and enthusiasm and also discernment from me, that they're looking after me and they know what they're doing and they are keeping to their side of things. And I have to let them do that. We have to let them do that. It's very easy to go wading in and start pointing the finger and saying, well, this is wrong and this hasn't worked, and if this were like this, then I'd feel this way. Ultimately, our team, they're human beings and they're doing a job, and mistakes are going to get made. No one is perfect. And it's about learning from those and communicating about them as well, you know, and that's why I said before, you know, feel as though you can speak up. So I guess in a very long way, what I may be saying is cut the people around you some slack. And as I say, I know for myself, it's the hardest thing to do when, you know, you go along. I've been along for a scan before. They've got me all ready. They've got me cannulas in, hooked up, you name it. And a signature has been left off a form, so they won't scan me. And they've told me that I have to come back another day. And I just think, oh my goodness me. And from where I am inside my head, do you know how blimmin' inconvenient this is? This is like the worst thing that could possibly happen right now. And I have, on occasion, I've absolutely put my foot down and I've got what I wanted. On other occasions, I've put my foot down and I haven't. And I've also learned that sometimes when the things don't go the way that we want them to, it's not because someone's trying to be difficult. It's not because, you know, people don't feel that we're important. Things just happen like that. And that's part of the experience of managing a disease, is that no part of it's ever going to be simple. It's not always going to be smooth. But there's a certain way that we can show up in that situation. And if we show up to our team, and whether we consider those people close, whether they're taking our bloods, whether they're, you know, radiographers, whether they're consultants, whoever they are, and whatever they're doing, ultimately we're working together. And if we show up with a certain amount of compassion for when things don't go the way we want them to, but also equally a certain amount of respect and appreciation for things when they do, a simple thank you makes the world of difference. So think of it as team. And you've probably heard the cliched expression, there's no I in team. And healthcare is kind of like that. There is an I because you are at the centre of it, but ultimately that goal that you're working towards has to be done together, because if you're going to try and do it on your own, good luck, because I've tried to do that before and it doesn't work. Okay, point number 3. This is an extra one I've thought about more recently, actually, over the past couple of years. So when things are not going well, and I feel like, you know, I haven't been heard, listened to, given the space I need, and I'm not getting the answers, I'm not getting the attention that I need, I've started doing this thing where instead of flying off the handle, getting really frustrated or lashing out, I've turned it back on myself and I've started to say to myself, okay, what is it that I actually need right now? Like, what do I need first? And then from that, and I make a little list for myself, what do I need? From that list, what from that list can I give to myself? And that's the first thing I do, because more often than not, if there's a situation, I open some results, or there's some news has come through, or I haven't got the answer I wanted, or I can't get hold of a certain person, in that situation, I'm having a response to that. I'm getting frustrated, I'm getting angry, and I'm getting emotional or upset. It's actually not going to help at that point, really, for someone else to come in and try and sort it out. What I have to do at that point is sit with that emotion and sit with that discomfort and go, okay, what's this trying to tell me? Like, what is it that I'm needing right now that I'm not getting? And the likelihood is that 9 times out of 10, I'd be pretty sure that it's something you can give to yourself. Usually on an emotional level, I'll give you an extra tip here, usually on an emotional level, it's space to feel that emotion. And we're not very good at that on the whole as a population of human beings. We don't really like to sit with those uncomfortable feelings. So the first thing I do now is I ask myself what I need, and can I give that to myself first? Sitting with emotions. How am I feeling? Am I tired? Do I need to rest? Do I need to, eat some decent food? Do I need to cancel a plan? Anything that I can do that immediately puts me back in a position of control to a certain extent. And then from that list of what I need, if I can't give that to myself, how am I going to get it? Who is going to help me with that? And then I literally write down, if I need this, who else is going to be there? and who can help me achieve that thing. In some instance, it might well be a doctor. You actually might need to get hold of the doctor at that point, and that may be the path you need to go down. But also there are so many other people around who can help, and very often we don't use the resources that we actually need. And the prime example actually is we thoroughly underuse, for example, our pharmacies. It sounds like a really funny example, but our pharmacists are incredibly well trained, incredibly well qualified, and know pretty much just as much about medications, about supplements, all sorts of things as qualified doctors, but we don't think about them because we think straight to the first, that person who, it is we can't get hold of or hasn't given us the answer we want. And that's taught me, actually, there are far more people out there who can help me than I think. It's not just me and this person or, this situation that's giving me a challenge right now. There's so much out there. It might be a friend who can relate. It might be a family member who, can come and take something off your plate. And I think that is one of the most important things that I've learned, actually, is to ask myself what I need. So, in summary, when communication is not great with your health, managing your health, when things could be better than they are, when you feel as though you're not being heard, seen, listened to, when you're feeling helpless, frustrated, confused, anything like that, and it's communication at the root of it, my 3 tips are really simply: be your own doctor. Remember you're on a team, so work together, be willing to work together, and then ask yourself what you really need. Can you give that to yourself? And if you can't, who can?